If your legs feel heavy by the end of the day, if you get a strange cramping pain in your calves after walking just a short distance, if your feet feel cold even when the rest of you is warm, please don't scroll past this video. What I'm about to explain could change how you think about your leg health, and by the end, I'm going to show you a simple drink, backed by real medical research, that may help support healthy blood flow in your legs. But I also have to be honest with you right from the start, because so many videos online will promise you a miracle fix, and I'm not going to do that to you. What I will do is give you the real science, explain it in plain English, and tell you exactly what to do, what to avoid, and when you need to call your doctor instead of reaching for a glass. Let's start with why this matters so much, especially once you pass 60. As we get older, our blood vessels naturally lose some of their elasticity. Think of a garden hose that's brand new, soft, flexible, easy to bend. Now think of that same hose after 10 years in the sun, stiffer, a little cracked, harder for water to move through smoothly. Something similar happens to our arteries over time. On top of that natural aging process, many of us also build up fatty deposits inside our artery walls over the decades, from diet, from years of smoking, from high blood pressure, from diabetes. This buildup is called plaque, and when it happens in the arteries of your legs, doctors call the resulting condition peripheral artery disease, or PAD for short. Here's a number that might surprise you. According to health data from the CDC and NIH, about 1 out of every 20 Americans over the age of 50 has some degree of PAD, and that number climbs even higher once you're past 60 or 65. That means if you're watching this and you're a senior, there's a real chance this applies to you or to someone you love. And here's the tricky part. PAD often develops quietly. Many people don't even realize anything is wrong until they notice they can't walk as far as they used to without their legs aching, or they feel a strange heaviness or cramping in their calves that eases up when they sit down and rest. That symptom actually has a name. It's called claudication, and it's one of the most commonly missed warning signs in older adults because people just chalk it up to getting old or being out of shape. But claudication is your body sending you a message. Your leg muscles aren't getting enough oxygen-rich blood when you're active because the arteries feeding them are narrowed. Now, before we go further, I want to clear up something important, because leg circulation problems actually come in 2 different flavors, and people often mix them up. The first is what we just talked about, arterial disease, where blood struggles to get down into the legs. The second is venous disease, sometimes called chronic venous insufficiency, where the problem is blood struggling to get back up out of the legs toward the heart. This is what causes varicose veins, swelling in the ankles, and that heavy, achy feeling, especially after standing for a long time. Both are common after 60. Both deserve attention. And interestingly, some of the same lifestyle habits, like staying active and staying hydrated, support both systems. So now let's talk about the drink everyone's been asking about, and I promise, I'm going to give you the real science, not hype. The star of the show here is beetroot juice. Yes, that deep purple, earthy-tasting vegetable juice. Here's why researchers have been so interested in it. Beets are naturally rich in compounds called dietary nitrates. When you drink beet juice, your body converts those nitrates into a molecule called nitric oxide. Nitric oxide is incredibly important for your blood vessels. It signals the smooth muscle in your artery walls to relax, which allows the blood vessel to widen slightly. Doctors call this vasodilation, and it can make it a little easier for blood to flow through, especially in vessels that are narrowed or stiff. This isn't just a theory from a supplement company. It's been studied in real clinical trials with real patients who have PAD. Some studies, including ones connected to NIH-funded research and published in respected journals like the Journal of the American Heart Association, found that patients with PAD who drank beetroot juice regularly were able to walk further before their leg pain kicked in, compared to people who drank a placebo. That's a meaningful, measurable improvement in quality of life, being able to walk to the mailbox, around the grocery store, or through the park without stopping every few minutes because of leg pain. But, and this is really important, I want you to notice the words I used, regularly. Modest improvement, not one glass and suddenly your circulation is perfect. Not an overnight miracle. The The studies that showed benefit involved people drinking beetroot juice consistently, often daily, over weeks, as part of an overall healthy lifestyle that included walking and other heart-healthy habits. Beetroot juice is a helpful supporting player, not the star quarterback who wins the game by himself. If beetroot juice isn't your thing, there are a couple of other drinks with real, though also modest, scientific backing. Pomegranate juice is rich in antioxidant compounds called polyphenols, and small clinical trials have shown it may support healthy blood pressure and blood vessel function. Hibiscus tea has shown similar mild blood pressure supporting effects in research. And green tea contains natural compounds called catechins, which some studies link to improved flexibility in blood vessel walls over time. And then there's the most boring, most overlooked, and honestly, one of the most powerful drinks of all, plain water. Here's something a lot of people don't think about. When you're even mildly dehydrated, your blood actually becomes slightly thicker and more concentrated. That makes it harder for your heart to push it through narrow leg arteries, especially if you already have some plaque buildup. Staying well hydrated throughout the day is one of the simplest things you can do to support healthy circulation, and it costs nothing. Now, let's talk about how to actually use this information, because I don't want you to just watch this video and forget it by tomorrow. If you want to try beetroot juice, a common amount used in research studies was around 1 cup, roughly 8 ounces, once a day. You can drink it straight, though the taste is strong and earthy. Many people prefer to blend it into a smoothie with an apple, some ginger, and a little water to soften the flavor. If the taste of straight beet juice really isn't for you, roasted or steamed beets themselves contain the same beneficial nitrates. But here is where I need to put on my senior doctor hat for a moment, because this next part matters more than the recipe. Beetroot juice is not right for everyone. If you have a history of kidney stones, beets are high in a compound called oxalate, which can contribute to certain types of kidney stones, so talk to your doctor first. If you take blood pressure medication, beetroot juice can enhance the blood pressure lowering effect, which sounds good, but it can sometimes cause your blood pressure to drop too low, leading to dizziness or fainting, so this is another one to discuss with your doctor, especially if your medication dose might need adjusting. And if you're on blood thinners, you should know that leafy greens and some vegetables contain vitamin K, which can interact with those medications. So again, check with your doctor or pharmacist before making it a daily habit. I know that might sound like a lot of warnings for a vegetable juice, but this is exactly the kind of honesty I promised you at the start of this video. A drink that has real biological effects on your blood vessels is not something to just start doing without a quick conversation with your doctor, especially if you're over 60 and managing other health conditions, which, let's be honest, many of us are. Now let's zoom out for a second, because I don't want you to walk away from this video thinking a glass of juice is your circulation plan. The single most well-proven way to improve blood flow in your legs, more proven than any drink on this list, is walking. When you walk, your leg muscles squeeze the veins around them, helping push blood back up toward your heart, while at the same time, regular walking encourages your body to build small new blood vessel connections around narrowed arteries over time. This is called collateral circulation, and it's one of the most remarkable things your body can do when you give it the chance. Doctors who treat PAD patients often prescribe something called a supervised walking program, walking to the point of mild discomfort, resting, then walking again, because this specific pattern has been shown in multiple studies to meaningfully improve walking distance and leg pain over just a few months. Alongside walking, there are other daily habits that genuinely move the needle. Quitting smoking is, without exaggeration, one of the most powerful things you can do for your circulation, because smoking directly damages the lining of your blood vessels and speeds up plaque buildup. Managing blood sugar if you have diabetes protects your smaller blood vessels, which are especially vulnerable. Keeping cholesterol and blood pressure in a healthy range through diet, medication if prescribed, and activity all support your arteries. And simply avoiding long periods of sitting, getting up every 30 to 60 minutes to move around, even just for a minute or two, supports both your arteries and your veins. Let's talk about food for a moment too, because diet plays a big role here. Foods that support healthy circulation include leafy greens, berries, fatty fish like salmon, which is rich in omega-3 fatty acids, nuts, olive oil, and of course, those nitrate-rich vegetables like beets, spinach, and arugula. On the flip side, Foods that work against healthy circulation include heavily processed foods high in sodium, which can raise blood pressure, foods high in trans fats and excess saturated fat, which contribute to plaque buildup, and excess sugar, which over time can damage blood vessels, especially in people with diabetes or prediabetes. Now I want to talk about something just as important as what to do, and that's when to stop reading home remedies altogether and go see a doctor. If you notice a sore or wound on your foot or lower leg that isn't healing, if one leg suddenly becomes cold, pale, or painful compared to the other, if you experience leg pain even while resting, not just while walking, or if you notice new or worsening swelling, redness, or warmth in one leg, these are not try a juice and see situations. These can be signs of serious circulation problems, including blood clots, severe PAD, or infection, and they need prompt medical attention. If it's sudden and severe, that's an emergency room situation, not a wait-and-see one. So let's bring this all together. If you're over 60 and you've been noticing your legs feel heavier, achier, or more tired than they used to, know that this is common, but it's not something to just accept as normal aging without paying attention to it. Simple, well-studied habits like daily walking, staying hydrated, eating a diet rich in vegetables and healthy fats, and yes, a daily glass of beetroot juice if your doctor gives you the green light, can genuinely support healthy blood flow over time. But none of this replaces a proper checkup. If you're having real symptoms, pain while walking, wounds that won't heal, color changes in your skin, please see your doctor and ask specifically about a circulation screening. It's often a simple, painless test called an ankle brachial index, and catching PAD early makes a real difference in how well it can be managed. I made this video because so many people in their 60s, 70s, and 80s are quietly dealing with leg circulation issues and either don't realize what's causing it or they're chasing miracle cures that don't actually work, while ignoring the simple, proven habits that do. You deserve real information, not hype, and now you have it. Before you go, let me quickly walk you through a few extra things worth knowing. The most common causes of poor leg circulation include peripheral artery disease from plaque buildup, chronic venous insufficiency from weak vein valves, diabetes damaging small blood vessels, smoking, prolonged sitting, obesity, and blood clots such as deep vein thrombosis. The symptoms to watch for are cramping or pain while walking that eases with rest, cold feet or lower legs, numbness or tingling, heaviness or swelling especially after standing, changes in skin color, slow healing sores, and weak pulses in the feet. The biggest risk factors are age over 60, smoking, diabetes, high blood pressure, high cholesterol, family history, a sedentary lifestyle, and obesity. For prevention, stay physically active most days of the week, avoid or quit smoking, manage blood sugar, blood pressure, and cholesterol, stay well hydrated, and avoid sitting for long stretches without moving. As for lifestyle habits, take daily short walks and gradually build up distance. Elevate your legs when resting. Wear comfortable supportive footwear, maintain a healthy weight, and limit alcohol while avoiding tobacco completely. For exercise, brisk walking in a walk-rest-walk pattern works well, especially if PAD has been diagnosed, aiming for around 150 minutes of moderate activity a week if your doctor approves, along with gentle leg-strengthening exercises and avoiding long periods of standing or sitting without breaks. And one more time, because it's worth repeating, the emergency warning signs that need immediate medical attention are a sudden cold, pale, or severely painful leg pain that happens even while resting, a wound on the foot or leg that won't heal, and sudden swelling, redness, or warmth in one leg, which could mean a blood clot. Please don't wait on these signs. Get medical help right away. If this video helped you understand your body a little better, do me a favor and hit that like button. It genuinely helps this information reach more people who need it. Subscribe to this channel if you want more honest, doctor-reviewed health content made specifically for people over 60. And in the comments below, I'd love to know, have you noticed any of these leg symptoms yourself, or is there a specific health topic you want me to cover next? I read every comment, and your questions often become future videos. Take care of those legs. They've carried you your whole life. Let's help them carry you a lot further. I'll see you in the next video.